as African Americans are more educated, we have better jobs, right? That produce more money, that give us better insurance, that increase healthy behaviors, that increase our years in life, right? So that is true for women and men. Now, women tend to be the drivers of scheduling the doctor's appointment,
Yep.
right? You have a doctor's appointment on this day at this
Right.
time. I need you
Right.
to be there, right?
Right.
And so that typically is how things are historically when there's a two-parent family.
Mm-hmm.
When there's a single parent family, that mom is, the one scheduling for everybody, for herself, for everyone, right? So increased education tends to improve outcomes and improve seeking healthcare. So as people are more educated, yes, they tend to get their mammograms more often. They tend to get their pap tests more often. They tend to get their annual well exams and blood work more often.
Hey guys, welcome to the Soul of a Man podcast. I am your co-host, Darren Bryant, aka DB. I am here with my podcast partner, my wonder twin, Michael Allen Humphrey, aka Chill. Chill, how
right.
you doing? Fine day, brother.
I'm doing good. And not believing this 70-degree weather in the middle of January.
You know what? I'll take it. But I'm afraid we're going to have a super hot summer at the rate we're going already. But you know what? There could be worse things.
Much worse. It's coming. It's coming, but I'll take it.
Absolutely. Well, look, ladies and gentlemen, we are here this morning, or this day, I should say, to talk to someone who I've known for quite some time now. Don't want to tell our age, but I'll do it anyway. So I've known her for about 35 years. As we stated on our last couple of episodes, we're kind of matriculating down this path to talk about second half living. And when Mike and I got together and started discussing this, we wanted to talk about how people, in particular our people, need to stop surviving, stop existing, and start living. And really, the only way you can do that is, first of all, make sure you're taking care of your health. And as we had Dr. Ed on last episode to talk about your oral health, today we have with us Dr. Latonja Ivery, MD, to talk about your physical health. Before we get into that, I'll just give you a little background about Dr. Ivery. Again, I've known her for 35 years. She and I share a relative. Her daughter is my niece, my oldest niece. I was around from the very time that Asia set foot on this earth, and I was the person who took her binky away. I don't know if you remember that, Tanya.
Yes.
Up in New York, she was walking around with a binky talking, and I'm like, yeah, that's not going to work for me, so let me have it. And from that point, she was done with her binky. So I take credit for that.
And I thank you, because she didn't have to have braces. So yes.
There you go. Exactly. I knew there was something about
That's
it.
right.
But anyway, again, I've known Tanya for quite some time now. I've always been thoroughly impressed with Tanya. She's just a brilliant mind. She will check you if you're not careful, as her kids can attest. And I used to just kid and tease Tanya all the time when we first met. Just about, I knew she was going through this medical school journey, and I just wanted to test her every chance I could, and she just gave it right back to me and then some. With that said, just a little bit about her background, and I'll let her share a bit more. Tanya got her undergraduate from Wake Forest University, where she was full scholarship. Yes, you guys have that in common. Where she received a full scholarship from the Z. Smith Reynolds Minority Scholarship. She majored in biology, and that's what she had her degree in, or got her degree in. From that point, she went on to the University of North Carolina at Chapel Hill, Tar Heels, to receive her medical degree. Yeah, and there she was actually a North Carolina Board of Governors scholar. So she went to medical school on a full ride, and she went to undergrad on a full ride. So
Wow.
I am sure there are some medical professionals out here in this world that are probably mad at Tanya because she didn't come out with as much school debt as some of them did.
Right.
But you know what? You should have been a little smarter. That's what I'm going to say about that. So she also did her residency at Franklin Square Hospital in Baltimore, Maryland. And then she did her family practice intern at the same hospital, Franklin Square Hospital in Baltimore. Guys, without further ado, I introduce to you our guest today, Dr.
Yes.
Tanya Mack Ivery. Tanya,
All right.
welcome to the Soul of a Man podcast.
Welcome.
Thank you so much. Thank you so much, Darren and Michael. I appreciate just this time to be able to be here. Just to share just a little bit today, just about furthering health, especially health for Black men. So I definitely thank you again for having me on your show.
Good deal. So before we get into the health talk, let's have a little personal conversation. Let's find out a bit more about you. Any more accolades that you want to share? I read your CV and it's longer than my arms. So I'm like, geez, I'll be here all day going through all of this. But anything that I missed that you want to share, talk about your family dynamics, kids, all of that good stuff. And then we'll jump into sort of the medical conversation.
Well, really just a little bit about me. I am a simple person. I mean, all the accolades, they don't mean a whole lot if you are not relatable to people. And that's one of the things I really strive for just in my practice. I have my own practice here in Wake Forest. It's Advanced Care North Wake Forest. And my focus, while I take care of all people from babies on to the end of life, my primary focus is women's health. One of the things I do that I'm the only provider in advanced care that does is something called colposcopy, which is where I manage abnormal pap smears, right? And so this is very timely because January is Cervical Cancer Awareness Month. And recently just did a series of podcasts on cervical health and cervical cancer awareness. So that's something just for people just to keep in mind, men and women, because that is something that can impact men when it's their partner who has cervical cancer, right? But that being said, as I was talking about just being relatable, I actually came from a single parent home. A single mom raised me and my brother, and she raised us to work hard to get what you want, right? Even with being a single mom, we were not poor. We were middle class because my mom worked 2 full-time jobs. So I give big props to my mother and to the example that she set of just working hard, being a hard worker. Even with that, just growing up, I it's funny. When I was 9, there was a gentleman who got hit in our neighborhood, and he was the son of one of our neighbors. And, he was hit and thrown into our front yard. So I went out and I was just holding his hand because I didn't know what to do. And I held his hand until the ambulance came. They took him away. And then afterwards, I told my mom, I was like, Mama, I need to be a doctor because I wanted to help him, but I didn't know how to help him. Now, why I didn't think nurse, because nurses are the foundation of medicine. I'm just gonna put it out there, right? I don't
Okay.
know why I didn't think doctor. I think nurse. I just thought doctor, and it was, that was the goal from there on out. And my mom made sure I was in activities and educational programs to kind of pave that way to make sure I could realize that goal.
Did you say that was 9 years old?
I was 9, yes.
And you just knew.
I just knew.
Wow.
Yeah. And I've always, from 9 on just wanted to just help people. And I just thought, doctor, help. And, the thing is, even with that, Darren was talking a little bit about, us having a relative in common. My oldest child, who I still call my baby girl, she actually, I had her while I was in medical school, right? And so we often joke that we both went to medical school. She went to medical school with me, right? But I put that out there not as a pat on my back, but really as an opportunity to say, if it's something you want to do,
Come on.
anybody can be a doctor. You just have to be willing to put in the hard work. Because I know for many people, having a baby and being in your first year of medical school could be a deterrent to realizing that dream, that goal. But if it's something you really want to do, and I remember a conversation with my grandmother. Because prior to actually having my daughter, I actually had taken a year off from medical school because my mom was sick. She had a stroke. And so I took a year off from medical school, and my grandmother, in tears, was like, please don't quit, baby. Please don't quit. Because I was actually one of only three people in our whole family who had ever graduated from college.
Wow.
So for my grandmother, me being in medical school was like, this is next level. And I remember her, like, she was like, please don't quit, don't quit. And I was like, I'm not quitting. This is just a pause. And
Yeah.
it's what I'm supposed to do because I only have one mama.
Right.
So I need to do what I need to take care of her. So, but I do feel like all of those experiences, my mom being ill and taking care of her, having my daughter while I was in medical school and taking a year off for her first year of life, those things I feel like make me the doctor that I am because I can relate to real people.
Yeah.
Wow. And you've heard me say this, I think you are a shining example, a true testament to all women, in particular women of color. A lot of times, women of color have the odds stacked against them for whatever reason, but you can certainly overcome those odds regardless of what they are, as long as God gives you breath and you wake up on this side of the earth and not the other side. So you can certainly make it.
That's
Um,
right.
so yeah, I appreciate that. And by the way, I know we mentioned Asia, but we cannot forget Raven and Christopher, your other two kids.
Absolutely. Absolutely. My
The-
my my
Raven-
my three jewels in my crown.
there you go. Raven's the second born, and Christopher's the youngest, if I'm not mistaken. Correct?
Yes, yes, yes.
Yeah.
So of the two of them, so Asia is 31, and Raven is 21, and Christopher is 18. Yes. So they are doing things, realizing their futures. Raven is actually, she lives in South Carolina now and is working and trying to figure out her career goals. And then Christopher is a freshman at North Carolina A&T engineering major.
Maggie
All
Pride.
right. You
All
proud?
right.
Well, good deal. So, Till, did you have anything before we move on?
No, let's dive in. I'm anxious to hear some of this medical talk.
Yeah, so as I stated earlier, again, we're talking about living our second halves, and that second half can mean whatever to you. I know for Chill and I, we are in our second half now, as we are both, Chill just turned 59, and I will be turning 58 in a couple of days, God willing. So yeah, so we're well into our second half, and I think there's some things that we probably could have done in our first half that would make the second half just a bit easier. Before we touch on the men's part, though, I would like to touch on just women's health because I wouldn't want to do this without including our sisters because those of us who are married, their health is important as those of us
Yep.
guys who are married.
Yep. Yep.
Their health is important to us because if something happens, we have to be the ones that are going to be there taking care of them.
Mhm.
So I think there were three things that I really wanted to touch on as it relates to women's health, and there's a plethora of stuff that we can talk about. But I look at what's really been impacting the African American community as it relates to our women. And one thing was heart health, breast cancer, and then honestly, women of our age going through menopause. If you're a married man and you're married to a woman who's going through menopause, you feel it. So I certainly wanted to talk about all of that. So let's get on to the heart health as it relates to women of color and talk about what we can do to catch it early, talk about what we can do to potentially help prevent heart issues and things of that nature, Dr. Ivory.
Right. So very good. Yes. So heart health, very important in men and women, but specifically right now we speak of women. So it's very important to have those annual checkups, annual exams. And that's just across the board for men and women. Like it really should be ingrained at least once a year, I see my provider, right? That's the minimum, at least once a year. One of the things is during that exam, it's really important to have a full comprehensive physical exam. Typically, that will include some lab work, right? So cholesterol levels, super important as regards to heart health. That will also include liver, kidneys, electrolytes, and blood sugar. That blood sugar, looking for diabetes, right? It typically includes a blood count to make sure there's no anemia. Also includes thyroid levels, right? Everybody as well, 21 and older, should have at least one baseline HIV and hepatitis C level, just to make sure, just for screening purposes, to make sure that that's not something that's sitting dormant in the background and going to come and bite you later, right? So that's very important. Those kind of general, just basic labs, okay? And if you have specific health problems, then there may be some additional labs that are required. If you have strong family history, there may be additional labs that are required as well. Mm-hmm. But in addition to the laboratory examination, very important to have a comprehensive physical examination. Now, I've noticed a lot of people have gotten to where they really just want to get lab work and they think that's their physical. That's not your physical, right? Physical needs hands laid on you, stethoscope on body, someone examining your skin, because, you know, a myth out there is that Black people don't get skin cancer. Well, Black people do get skin cancer. So someone needs to be checking out your skin on a regular basis, right? Your partner sees you on a regular basis. So that person can kind of keep an eye out if they see anything unusual. But at least once a year, your primary care provider should be looking at your skin, listening to your heart, you know, checking out the eyes, ears, nose, mouth, all of those things.
Got it. Why do you think, and this is just stuff I've read and heard, that a lot of women of color have had heart issues? Is it due to undue stress over the last few years? We have a lot of single mothers out here. Again, that could be a whole nother show in terms of absentee fathers or whatever, but they've had the stress of being mothers, working, being providers. So we've seen a lot of growth in terms of women having heart attacks. What do you think that's attributed to?
So yes, and yes, right? So first and foremost, one of the huge things in managing heart disease in women is stress, especially African American women. There tends to be a trend to put more responsibility on African American women. And because we have traditionally been the caregivers for the family, we take care of the parents, and then we're taking care of the kids, and then we're taking care of, depending on who you are, you might be taking care of your spouse, you know. So there are multiple stressors that impact the African American woman's health. So first and foremost, stress management. Okay. Mm-hmm. It's okay to say no. It's okay to have boundaries. Right. It's okay to say, I can't do that. Yeah. It's okay to say, I can't do that right now, but I can get to it. Like, right. All of those things are okay. And I think sometimes, especially as African American women, because we're used to doing everything for everybody all the time, plate running over, spilling on the floor, mm-hmm. right? We're not used to saying no. And then when we do say no, we feel guilty about it. Mm-hmm. It's okay. It's okay to say no. I'm pretty good at saying no. Right?
I would never come to that.
But it's learned, honestly, because I'm gonna to be totally honest with you, that's only come within the last, I would say, 5 or 6 years for me, that I have been able to say no and feel okay with saying no, because boundaries are super important. So just stress management, very important. Another thing that impacts that heart health is weight. I'm just going to say this right now, that our race has a hard time with the word obesity. Mm-hmm. Obesity is a real thing. Not everybody is big boned or overweight. There are some people who are overweight and fit into that category, and that is a specific BMI. And yes, the BMI range was not specifically designed for African Americans, But unless you're 7 feet tall, you can't weigh 300 pounds and still just be overweight. You're obese.
Right.
Okay.
Right.
So we got to come to terms with where we are. We got to, first you have to identify the problem before you can actually do something about it.
Right.
So, weight management is another huge issue that impacts heart health, right? And what do we need to do to be able to manage weight? So, there are multiple factors that go into being overweight or obese, right? Not everybody's the same size. There are genetic factors, absolutely. There
Yes.
are metabolic factors. There are some people who have thyroid disease,
Mhm.
right? There are also other factors like access to good food,
Yes.
access to health care, right? Access to better opportunities for health and fitness.
And
But you
those
know
are
what?
systemic issues.
I'm sorry.
And those are systemic issues in our society.
Absolutely. Absolutely. But you know what? Most of us can go outside, and I say most because not all neighborhoods are the same, right? But most of us can go outside and walk up and down the street for 30 minutes, right? We just have to make that time. And it doesn't, I would tell my patients, it doesn't have to be 30 minutes consecutively. Do 10 minutes before you go to work, do 10 minutes at lunchtime, do 10 minutes when you get home from work, but get it in. Like
Right.
one of the things we definitely have to do is just stop making excuses and
Mhm.
just do it. All our lives are busy, right? But busy can't be the reason that I continue to be unhealthy, right? And
Right.
so, again, you definitely, hit it on the head. There are some systemic issues, right, that keep us in a space where we're not taking good care of ourselves. But there are little things that we can do each and every day. Drink more water,
Mm.
right? Drink more water, at least 64 ounces a day. Really try to get in those 5 servings a day of fruits and or vegetables, 3 servings of protein, 2 servings of dairy. And if you lactose intolerant, because that's a real thing, just make sure you're getting your calcium. And these are all things as women, because that calcium, along with the vitamin D, is going to help with bone health. So that
Right.
later in life, people aren't osteoporotic and, hunched over because their bones have not been taken care of, right? Exercise, weight bearing exercise, along with that goes a long way. And that's going to be 30 to 45 minutes, 4 or 5 times a week, getting that heart rate up. And then 2 to 3 times of toning, strength training, or resistance training. Okay.
Wow.
So those are just some things just to really impact and improve our heart health, right? You don't even have to have a membership pass to the Y or to Planet Fitness or, Lifetime. Those things are great to have, right? But we can just go outside and walk. You don't even have to go outside. I tell some people, walk laps around your house.
Yeah.
You go into Walmart, right? Before you buy anything, walk around the perimeter of that store for 15 minutes. And yes, the cameras are going to be looking at you, but then you go and buy whatever you're going to buy,
Right.
right?
Right.
But utilize those different opportunities. Park further from the store, walk up. Don't look for the closest parking space. When you're at work, take the steps instead of the elevator. These are all just small things that just are behavioral changes that we can do to improve heart health.
Doc, Darren told me you were the truth. Um, our viewers are going to love you.
Oh my goodness.
I,
And,
Well,
let
I
me
hope so.
let me put that out there first. I got to backtrack a little bit to the weight loss. Um, in recent weeks, we've seen the Color Purple press junket, and Miss Winfrey seems to have slimmed way down. Within the past 2 days, superstar rapper 50 Cent has been seen in pictures where he slimmed way down. And the topic of Ozempic has
Hmm.
come up.
Hmm.
Can you talk to us about Ozempic pluses, minuses, dangers, etc.?
Yes. So before I talk about a specific brand, because I'm not here to condone any brands, right?
Okay.
And we're going to talk about all of them. What I will say is there is a stigma about weight, right? There's a stigma about, being overweight or being obese, and people receive you differently depending on the size you are when you come into the room.
Right.
Let's just be honest, right? People tend to interact more with people who are slimmer than people who are heavier, right? And I think that's an unconscious bias. For some people, it's very conscious, but then for other people, it's an unconscious bias, right? So that being said, the trend is to lose weight and to be smaller. And for some people, that is a health concern, and for other people, it's aesthetic. I just don't look good. I want to fit in this size 2 jeans, like, right? So there are different motivations behind weight loss. The goal, though, has to be and should be better health, right? Because it's not a specific weight that you should want to get to, it's a specific health level that you want to get to.
Got it.
Okay. So that being said, right now there definitely is a trend and it's a rage. And I cannot tell you how many people a day I talk to about weight and, incorporating some of these newer medications that help people to lose weight. So Ozempic is in a category of medicine called GLP-1s. And basically that class of medicine works two ways. It works in the digestive system by helping to basically slow things down. So it makes you feel full faster, longer, but on the other end, it can cause like some other side effects, constipation, bloating, that sort of thing. But those are manageable, right? Because if you're trying to get skinny, you all right with feeling a little bit bloated, right? You just take some medicine for that. Okay. So that's the first thing. That's the first way that those medicines work. The second way that they work is actually in the brain. And they turn off that food chatter. Because for a lot of people, especially women, and especially women who are emotional eaters, there's this food noise all the time. I think about food. I want to eat. Like they can just finish eating, but they're thinking about what I'm going to eat for my next meal, and that's a real thing. And for a lot of people, that has to be turned off. Right? Sometimes that can be turned off with medicine. Sometimes that can be turned off with, psychotherapy. But for many people, that has to be turned off.
Right.
And so that's where this class of medicine works really well. There are lots of medicines that are in this class. Ozempic is one, Wegovy is one, Mounjaro is one. Although Mounjaro is marketed for diabetes, people are using it for weight loss. Zepbound is the new weight loss version of Mounjaro. There's one called Saxenda that was out before all of those. However, that one is kind of fallen off in favor because it's a daily injection, whereas the other ones are a once a week injection, right? But they work very well. So they work very well to help people to, one, decrease those habits of eating all the time and, just being grazers, right? So it helps to decrease the appetite, but also helps the metabolism to get rid of that excess fat and weight.
Wow.
Great.
So,
Darren,
Tanya, you'll be happy to know, and this is not through Ozempic or anything else, I am down about 7 pounds since you and I met for lunch. Almost.
All right. Come
I'm
on
getting,
now.
I'm getting to my fight weight.
So how are you doing that? How are you doing?
I haven't had sweets or carbs in almost 21 days now. No soft drinks, no cookies, no cakes, which is my nemesis.
Okay. All right, good. So what are you substituting for the sweet tooth? Because that's where a lot of people get in trouble. Like they stop all this stuff and then all of a sudden they're like, I can't take it anymore. And they eat a whole bag of M&Ms.
I got a refrigerator full of oranges and apples.
There
That
you
gives
go.
me that kind of sweet fix.
There you go. There you go.
I told Children, I think it was a couple of episodes ago, we bring a sexy back this year.
Okay. All right. Come on, bring it back.
Here we go.
So I was actually when I just said people eat the whole bag of M&Ms, that was me. Because I remember about 10 years ago, I was doing this little fad diet thing and, just trying to eat the bananas and I can't stand bananas. So I'm trying to force them down. They're trying to come back up, all of this stuff. And I got to the end of that little diet plan and had gained 2 pounds. I ate a whole pound of M&Ms. I was like, if I'm gonna be fat, I'm gonna be happy, and I'm gonna eat what I want to eat. Right? Not realizing that my cycle was coming the next day, and that's why I had gained the 2 pounds. So anyway, there's that.
Yeah, I got a couple suits that I need to get back in because I can't afford to
Okay.
go buy any new ones right now. So
Okay.
it's easy
Okay.
for me to lose weight and spend money.
Whatever motivates you to get where you need to go.
There you go. So
With
look really quick, let's shift if we don't mind, because I know we'll be running up on time before long. I want to talk about another thing that before we even get to the brothers, another thing that's really prevalent amongst sisters and just women in general, breast cancer.
Mhm.
Let's talk about the importance of self-examination as well as going to get your mammograms on an annual basis, depending on what age you are.
Mhm.
I know a lot of times for Black men, my doctor suggested that I started getting prostate exams at 40.
Mhm.
He said, look, I
Mhm.
saw Black men do it at 40 and let everybody else do it at 50 or whatever that age was whenever they were supposed to start. So I suspect the same thing holds true for women of color.
Yes, absolutely. So first and foremost, I start teaching teenagers how to check their own breasts. That's a little taboo for teenagers to touch their own breasts, and I'm like, they're yours. Get used to what they feel like, right? Because whenever they stop feeling like you're used to them feeling, that's when you come see me.
right.
Right? So very important. Teach women, check your breast. Typically after your cycle, that's whenever they're not as lumpy, they're not as tender. You don't scare yourself to death that you found something when there's not really anything there, right? So very important self-breast examination. Second thing is mammograms starting at age 40 as a baseline. If there's a family history of breast cancer, typically that first mammogram needs to be 10 years before that breast cancer was diagnosed in that first degree relative. Break that down because that was a whole lot. So if you have a mother or a sister or a father who has breast cancer, right? The age that they were when it was diagnosed, your first mammogram should be 10 years prior to that age. So let's say mother was diagnosed at 40, your first mammogram needs to be at 30, right? Because we're trying to be proactive here and preventive.
Right.
So when there's also a strong family history of breast cancer, then that's when genetic testing tends to come into play and be very helpful, right? And so those things are important. So between 40 and 50, typically, every other year for a mammogram is recommended. After age 50, once a year is recommended. For people who have that screening mammogram and then it comes back and there's something a little abnormal, there may be a recommendation to do every 6 months along with an ultrasound for a while until that area is found to be stable. Right. And then whenever there's suspicion or, a lesion appears to be changing, a breast biopsy might be recommended.
Okay.
Yeah.
Got
Do you see specifically women in the Black community following these guidelines? Or are we so far away from where they need to be? Kind of like with men and prostate exams. Do you see women following the guidelines suggested by the medical profession in regards to
So,
mammograms?
so one of the things that has really improved is as we are more educated, as African Americans are more educated, we have better jobs, right? That produce more money, that give us better insurance, that increase healthy behaviors, that increase our years in life, right? So that is true for women and men. Now, women tend to be the drivers of scheduling the doctor's appointment,
it. Yep.
right? You have a doctor's appointment on this day at this
Right,
time. I need
right,
you to be there, right?
right.
And so that typically is how things are historically when there's a two-parent family.
Mm-hmm.
When there's a single parent family, that mom is, the one scheduling for everybody, for herself, for everyone, right? So increased education tends to improve outcomes and improve seeking healthcare. So as people are more educated, yes, they tend to get their mammograms more often. They tend to get their pap tests more often. They tend to get their annual well exams and blood work more often.
Okay. And Doc, you mentioned men. You mentioned uh, fathers, an example that you said earlier. So men can get breast cancer. And how do we examine and check ourselves?
Just like women. So what I usually tell my men when I do their annual physical exam, I say at least twice a year. I need you to check your chest. I need you to check your feeling. You're pressing around. You're seeing if you feel something on one side that's not on the other side. You're feeling underneath your arm all the way up to the collarbone. You're checking to see if something feels asymmetrical because breast cancer is not symmetrical. It's not going to be on both sides in the same exact place,
Got it.
right? So
Got
you're going to find something that's a little unusual on one side, and that's when you go to your doctor. But the thing is, if you're not looking,
it.
it'll be late when you find it.
Got it. Got it.
Wow.
Do we all have cancer cells in us? Is that a myth that I've heard? And they have to be, for lack of a better term, kind of activated at some point. Do we all have cancer cells within our body?
So the thing is, we all have cells that transform and change on a daily basis. And we have cells that could potentially be cancerous and grow into lesions, nodules, masses. But you also have an immune system that fights those things every single day, which is one of the reasons is it's important to make good healthy food choices, like avoiding a lot of fat, because an increased fatty diet, for example, increases your risk for colon cancer,
Mm-hmm.
right?
Mm-hmm.
An increased fatty diet increases your risk for breast cancer. So it's important to eat those 5 servings a day of fruits and or vegetables, antioxidants, drinking black coffee. And, there's kind of this whole controversy about is coffee good for you, but antioxidants are good for you, right? Making sure that you're eating the fish, making sure that if you don't like the fish, you take the fish oil, or you at least get the omega-3s in eating walnuts, making sure that we are making these good informed decisions on our health and on choosing the right foods so that we can have good heart health
Good.
and good overall health. I actually had just put down a list of supplements that's important just in general for men, and these are specifically for men, right? One of the things that I typically recommend is taking a multivitamin, a men's multivitamin, okay? Along with that, to make sure that we're having good prostate health, having vitamin E, zinc, and saw palmetto.
Mhm.
Vitamin D for immune system improvement as well as for good colon health.
Mm-hmm.
And then having magnesium, omega-3, and folate.
And that's something we can get in a single daily multivitamin, or you've got to take each individual thing.
Mm-hmm. So a multivitamin is going to have some of those things, right? A multivitamin will probably have vitamin E. It'll probably have some vitamin D, but not enough. You should be getting at least 2,000 international units of vitamin D per day. And in the winter, I tell people take 5,000 because there's a whole immune system cocktail for the winter time, which is vitamin D, is going to be zinc, is going to be a probiotic, is going to be fish oil, and vitamin C, right? And you would be taking like larger doses than just the average regular recommended daily allowance. But again, I would say talk to your primary care provider about the specifics of what you should be taking, what you should not be taking, because with this just being a general podcast, it's very difficult to get the intricacies for each individual person, right? Because it's also going to depend on what health conditions that person has, what tolerances or intolerances they have. So take these as recommendations.
Yes.
And talk with, primary care provider.
Yeah, I know GNC has a really good multi-pack that has the saw palmetto and a few others. I think it's about 5 or 6 pills that come in a pack, and it's sold in a box of like 30. They're not cheap by any stretch, but they actually,
No.
I understand, tend to work pretty well and knock out all of those areas that you were just talking about, Doctor.
Mm-hmm. Mm-hmm.
So one last thing on the women's health, and then we'll jump into the guys.
Yep.
Menopause. A lot of men our age are now, with if we're married or maybe dating women our age, we're having to deal with that. And I say deal, and I don't mean that in a derogatory way, but we don't, as men, don't understand it because it's not something that I think we go through. We might, but we don't go through it the same way women do. Let's put it that way. When you're sitting down and all of a sudden your wife or girlfriend or whatever has the air on 40 and it's 30 outside. And
Right.
you're like in the house bundled up with a parka on and a blanket trying to understand why
Right.
she has the air on. Let's talk about menopause just a bit.
So menopause is that stage in life where hormones change and fluctuate, levels start to decrease, and it is that transition as those hormones are changing that gives us the symptoms that everybody, is so familiar with. Being drenched from head to toe, standing in the middle of the grocery store line, and all of a sudden feeling like you're on fire from your head to your toe. Having difficulty with sleep. That's a huge one for women going through menopause, as well as weight gain, unexplained weight gain. And I see the sleep issue and the weight gain issue very often because those are the things that get people out of sorts. Those are the ones that is like, okay, wait a minute, what is going on here? And one of the things that I typically will tell women is, first and foremost, make sure that you are limiting sugar and alcohol. Sugar and alcohol tend to drive that flushing, those hot flashes, right? So limit sugar and alcohol, first and foremost. Second thing, increasing dietary sources of soy milk, edamame, yams, tofu, because those are all sources of plant estrogens, because it's the hormone estrogen that's being depleted that is giving us those symptoms, right? So being able to incorporate more of those things into the diet will help some with supplementing that estrogen. And then, there's black cohosh and soy. There's different supplements over the counter that can be taken to help with those symptoms as well. But again, none of those need to be taken unless the person talks to their primary care provider.
Got it. So from the male perspective, and I think a lot of this is just us being sympathetic and empathetic with our spouses or significant others. Because let's just face it, sometimes we don't understand because it's not happening to us. What can we do, whether it's from a support perspective or whatever, to help our significant others as they're going through this process?
Because being a cycle breaker means that you are in the forefront of what is happening. You got to take the hits. It's only hard because you've not done it before. But if you look back on what you've overcome, your perspective on what's happening next would shift.
Just the same way it says, some assembly required to get free and stay healed, some disassembly is required.
No more negative cycles. Regardless of what happened to you, you can make decisions to not let it negatively impact you anymore.
I speak that people will see you and they will recognize that a shift has happened and they will ask you, how did you do it? Cycle Breakers Conference 2024.
Hey guys, this is DB with the Silver Man Podcast. Hey, we really appreciate you guys rocking with us all these months. The feedback has been amazing. We hope to continue to bring you amazing content. We need a huge favor from you though. We need you to like. I think that like button is somewhere right here. We need you to share. I think it's right here maybe. And we need you to subscribe. Come on guys, keep rocking with us and share this content. And we want to reach millions. We appreciate you.
I would say the first thing is to acknowledge it as a real thing. Try really hard to avoid projecting that she might be crazy, or that this is just all in her head, right? Because that's not going to get you anywhere far. The thing I would, in fact, you might be in trouble. you know, the thing I would say is to provide some more support. Ask what it is that your partner needs from you. Like, how can I help you whenever you're having this situation? Is there anything I can do to help, or do I just need to sit down and be quiet?
Mhm.
Right. So ask the specific, because that may be different for each person. That may be different, you know, what they need. They may need you just to kind of talk to them while they're doing it. They may need you to fan them, or they may need you to go in the other room and just be out of sight and out of mind. Right. So just really support during those times is probably going to go a long way.
Do you recommend that the gentleman actually frequent a doctor visit or two with their significant others, just so they can get it from a medical professional and really understand? Because a lot of times, you know, when your spouse tells you, you're like, okay, I hear you, but but do you understand? So would you recommend going on a doctor's visit with your spouse or significant other?
Honestly, I think that shows compassion and love just in general. Just being able to go to a doctor's appointment, whether it's dealing with hot flashes, whether it's dealing with, you know, this person is going through some mood disorders, whether it's a new diagnosis of diabetes or hypertension, no matter what it is, being there and extending that support system to your partner, it goes a long way. Right.
Okay.
And it helps both in education of you, you know, to your partner, but it also just helps in the intimacy in the relationship, which helps and needs to grow as we are getting older and bodies are changing. People aren't looking the same. That intimacy still needs to grow.
Absolutely. Well, good deal. Let's pivot and get on to us gentlemen. I think, and Mike and I, Jill and I talk a lot about this. There are a couple of things that are, well, more than a couple, but a couple that comes top of mind when we talk about men's health. Number one, hypertension and high blood pressure. I think you were talking to two people. I know at least one, and that's me, who suffer from this. And if I'm not mistaken, you do as well, my friend. Okay.
Yeah.
So that's one big thing amongst our community. Another, obviously, is prostate cancer and making sure we get our exams. We touched on this a little. And then lastly, you know, as you start to get up there in age, the soldier doesn't necessarily salute the way he used to. So let's talk about this thing called erectile dysfunction amongst men that are in their 50s and sometimes even in their 40s. But we'll start with the hypertension and high blood pressure.
Okay. And so I'm going to add one in there. So
Okay.
hypertension, prostate cancer, diabetes, and then erectile dysfunction,
Okay.
right? Because really, all three of those, the hypertension, prostate cancer, or prostate health, and diabetes impact erectile dysfunction, right? So just talking a little bit about those. So hypertension is really big in our community, right? And we touched a little bit about some of those socioeconomic disparities that impact that, access to good health care, access to good food.
Right.
You know, I remember I grew up in Wilmington, and about a year or two ago, I drove through the side of town where my mom grew up. There are no grocery stores.
Yeah.
There are no grocery stores. There's corner stores. I remember Miss Ruth corner store with the big hoop cheese on the counter, right? That was kind of the grocery store for the neighborhood. The closest grocery store really was about 10 miles away.
Yeah. Yeah.
Right? And if you don't have the transportation to get to the 10-mile away grocery store, then you're going to eat from, most of your stuff is going to be in a can. And it's going to be overly processed, right? So being able to have access to better food choices, and this is where we talked a little bit about having higher education, increases access to dollars, increases access to healthcare. That's where those things are able to impact the food choices that we make. Right. Those fruits and vegetables, those lean meats. Now, everybody right now is on this plant-based diet kick. Okay, that's great. Eat your vegetables. That's what I'm going to say, plant-based. Eat your vegetables. But it's okay to eat meat. Just eat lean meats. Eat meat that's not processed, right? Stay more with the seafood, the fish, the shellfish, that sort of thing, because those things are easier to digest and better for you, right? But it's okay to eat meat. I just want to put that out there because everybody wants to do a whole plant-based thing right now, and that's good for some people because there are some health conditions that being on a plant-based diet is better for, but it's not necessarily something that everybody has to do.
On that front, Doc, when we go into the grocery store and we see grass fed and we see organic, are those things real?
It depends on what store you're in.
Ah, okay.
So
Explain.
the thing is, grass fed, great. Most cows eat grass, right?
Right.
I don't think I have ever met a cow that didn't eat grass. So grass fed is really a marketing tool, right?
Okay.
It sounds good. Oh my
That's my
goodness, it's grass fed.
yeah.
Yeah, I need to be getting that, right? That's a label to put on the package so you can mark it up.
Right.
Okay. Now, organic, on the other hand, tends to help us to get away from the pesticides and from the preservatives and that sort of thing, which is important. And one of the ways you can know if something really is organic versus I don't think that's true.
Right.
Compare the size of that organic chicken to the
Yes.
regular chicken, right? It's going to be
Right.
about half the size,
Okay.
Yes.
right? It's going to be
Chickens should
about
not
half the
look
size.
like chickens
What do
should
you
not
say?
look like turkeys.
Right. A chicken looking like a turkey is a problem.
It's a problem.
Okay, right, it's a problem. So, yes, being able to have access to those organic foods, and we can just, nix the whole grass fed label, but having access to those organic foods and basically foods that aren't, you know, pummeled with preservatives is the important thing. Actually, even being able to have a garden and growing your own food, or at least some of the food, is actually a good thing. And sometimes it's the easy way to start that is just being able to have an herb garden. Growing the herbs that you're seasoning your food with, so that the temptation is not just to douse salt on everything.
Right.
Right. So that's another way to kind of help improve health, is being able to grow at least some of our own food.
Okay.
So back on the blood pressure hypertension piece, my father had high blood pressure. If I'm not mistaken, a lot of that can be hereditary. Correct?
Mm-hmm. Mm-hmm. Yes. Yes, because I have patients who they may be 5'6", weigh 150 pounds, which is very much in the average weight, not overweight at all, and they may have high blood pressure. But their mother and father both have high blood pressure. Their brother has high blood pressure. Their grandfather had high blood pressure. So there is a genetic component, right? And you know what I tell them? You should have chosen your parents better. Right? But there are things that they can do. That there are things that they can choose. They can choose not to add the salt. They can choose to limit the caffeine, right? And exercise. Exercise that 150 minutes a week that we just talked about, and drinking water.
So, with all of that, you can kind of reverse the genetics per se.
You're managing the genetics because you're not
Managing.
changing your genetics. You're managing what's there. And you may even be able to manage your diet, exercise, and behavioral choices to the point that you may not even need medicine.
Got
Right.
it.
So those are all reasons why. So when you go to the doctor, they're like, you need to lose weight, you need to that sort of thing. Right. But there is some science behind, as you're getting your weight to an optimal level, it helps your blood pressure. Right.
Mhm.
The things you're putting in your body. So there's something called a DASH diet, which is higher in certain combinations of fruits and vegetables, that helps to control blood pressure.
Got it. Got it.
So these are all the things that we can control. Genetics, not so much, but those other pieces, we control what we control, and the other part we manage.
How do we get that message across when historically and culturally we have cooked the way we cook? I mean, nobody could cook like my grandmama. The closest thing to it was my mother, who used my grandmama's recipes,
Right.
which contain ham hocks and other pork products. It wasn't no smoked turkey. We were coming off the hog,
Oh, right.
and it was all seasoned that way. So my taste now want those flavors, and I'm using the same recipes. But in addition to that, in this whole subject that we're talking about, it's been interesting as we talk to a slightly younger demographic, because we're talking about the second half. And this came about because as I hit 50, Darren hit 50, our peers said, oh, we hit 50. We're halfway there. And that's making the assumption that you're going to live to be 100.
Right.
CDC gives us about 72, 73 years.
That's right.
So when we're talking to these 35, 36-year-olds now, you say, what do you mean I'm in my second half? Like, you're in your second half. But bringing that up because even younger people changing their diets and eating habits, when grandmama and big mama and all the rest of them were cooking in the way that they did, how do we change that mindset, change those taste buds to get people eating more healthy?
I'm going to say right now, the nostalgia of you just saying the big mama, because that was my grandma. My grandma was big mama. Okay. So my mom and my grandmother, amazing cooks. Okay. Yeah. Mm-hmm. So my mother, I'm fortunate enough to have my mother live with me now. And so I am able to reap the benefits of my mother cooking. That being said, I'm like, Mama, we can't buy the ham hocks. We just can't buy the ham hocks. And if you're going to cook those beans, can we do a smoked turkey neck? Yeah. Okay. And so since I'm typically the one who goes to the grocery store, I can manage that.
Right.
So that, it really is a change of mindset. It really is a change of basically our behavior, like what we've been doing for so long. Just because I've been doing it for so long does not make it right. At some point, we have to make a decision to be different. Okay. Right. And so, adapting those recipes to make them, more, to make them more, what I'm saying, healthy now. Right. Yeah. So, it's just really, again, just a matter of making good food choices, changing behaviors, changing our thought process, and, still eating good, right? Yeah. Not everything needs to be fried. Not everything needs to be boiled, right? Yeah. So we can saute, we can broil, we can bake those things, and it still tastes good. So just change those behaviors.
Here's the funny thing, though, when you think about it and you look at it through generations. Honestly, our generation, meaning Gen X, we're starting to really be the last ones to eat that way, and maybe some millennials. But if you look at these younger kids, they tend to eat a bit more healthy than we do, and I don't know what I think it's actually a more of an aesthetic thing for them. So hey, I'm vegan, so I want to be vegan. Or I am, pescatarian or whatever it is. So I want to do that. And for them, it's more of a societal thing. They want to fit in sort of these groups. So they tend to eat a bit better than we do. I think we're the last fatback, ham hock,
generation.
Everything else generation. These other kids are like, yeah, no, we're not doing that.
Yeah. Well, see, that's Darren, that's only because they haven't been to your mother's house for Thanksgiving, because Miss Ruth puts it down. So, that's the only reason. But I tend to agree with you. I think it's, there are more fads. There are more eating clicks, and I think that the younger generation is more likely to go and get pho, right? Mm-hmm. And, noodles versus there really is not a ham hock and collard green restaurant.
Right.
There are some little, hole in the wall, restaurants that, when you find one in your town, you're like, ooh, right? Because because you're not cooking that way anymore.
Right.
Right. So yeah, it is a trend towards change.
Yeah.
Got
Yeah.
it. So it sounds like obviously a lot of health issues, whether they're male or female, diet is obviously driving a
It
lot of.
is. Mhm.
And so what I would suggest, especially to any of our young viewers, think about what you're putting in your mouth now. And that did not sound right. So pause, but think about what you're eating now. Think about what you're eating, because the impact and the effects that it will have on you later in life, you just have no idea.
Yeah.
I wish I'd eaten a lot better when I was a much younger man.
Yeah.
Let's jump into this thing, Doc, if you don't mind. This whole erectile dysfunction. It's funny. You see all the commercials.
Darren,
And
let me stop you 1 second, because we missed prostate cancer.
did we?
We did.
Okay.
Yeah.
That's
Yeah,
bad.
Yeah.
Because that has an impact on it as well, so as we know.
Exactly. So the thing I would say is, I applaud your provider for starting with those prostate exams at 40,
Yeah.
right? Because the recommendation is to start at 50. Now, I actually tend to do that digital rectal prostate exam starting at 45. And that's outside of the recommendation. But I will tell, especially my African American men, prostate cancer occurs at a younger age in African American men. So we're going to look for it at a younger age. So with your consent, I'm going to go ahead and examine your prostate. We can always do it in the blood. Now, the good thing is that the U.S. Preventive Services Task Force has recommended that the prostate specific antigen be tested now at age 45 for everyone. It used to be that the recommendation was at age 50 for everyone and age 45 for African American men. But guess what? Insurance companies just started paying for it. So even though that was the recommendation, if you wanted to have that done as an African American male at 45 to 49, you had to pay for it yourself, right? And so we already talked about some of those disparities in salaries and income and that sort of thing. So a lot of people weren't necessarily going to just be like, well, yes, sign me up for that, right? But another reason to do a digital rectal examination earlier versus later. But now, age 45, insurance companies are paying for that examination. And again, things to do to support prostate health: decrease fat in the diet, right? Limiting fat in the diet. I cannot say that enough, because that impacts multiple types of cancer: colon, prostate, breast, all of those things, right? And then making sure that you are doing the supplementation, you are getting the vitamin E and the zinc and the salt palmetto to support prostate health. Go
Sorry.
ahead. No, go ahead.
We just lost Dexter King in the past couple of days to prostate cancer. But it's one of those strains of cancer, I hope you can speak to it, that with early diagnosis and treatment is no longer a death sentence.
Exactly. So one of the myths surrounding prostate specific antigen. So the normal range is 0 to 4, right? When you get to 4.1, that's abnormal, right? But the other thing, whenever you're getting regular checkups, is the rate of rise in that antigen. So let's say this year you have your prostate specific antigen and your level is 0.2, okay? And then next year you have your prostate specific antigen drawn and it's 3.5. Now that's still in the normal range, but that's a huge jump.
Yeah.
That is a huge jump. So it's not just the absolute number, but it's also the change in that number that's important.
Got it.
Okay. And so that's something I really want our viewers to pay attention to your numbers. Like, you need a copy of your lab results every year. And I'm saying every year because I know after this, you're going to get your exam every year, right? So you need a copy of your numbers every year so that you can see changes and variations in your numbers from year to year. Because if you're paying attention, right, you can ward something off before it becomes a problem.
Got it.
And just for those who don't know, or maybe not have had it yet, your PSA, which is what Dr. Tanya is talking about, is only done through a blood draw. So you have to go get lab work done in order to do that, to see what your PSA count is.
Right. And now I will say that PSA, along with the digital rectal exam, is the best care for prostate health and prevention. There are some people who opt out of the rectal exam, and okay, I get it, people feel like they're violated or whatever. But in the healthcare setting, that actually goes a long way in conjunction with the PSA to preventing prostate cancer.
Got it. The invasive nature of it seems to be one of those things that with Black men in particular, and probably men in general, but Black men in particular, sometimes prevents us from doing. And the other thing, kind of jumping subject of staying in the cancer realm, is colonoscopy. Speak to that.
Yeah. So I will. So I'm gonna back up to the prostate cancer for just a second, because the thing is, your primary care provider, you should have a relationship with that person, right? It's a professional relationship, but it should be a relationship, and it should be such that you can say, Doc, I really don't feel comfortable, with you doing that digital rectal examination. Can you tell me why that's important to do? Do I really need to do that? Like, those are the conversations you need to be able to have with your primary care provider. And I'm going to say right now, if you can't talk like that with your primary care provider, get a new one. Get somebody that you can actually talk to about what your real concerns are, right? Not just my wife told me to show up here and do this exam, right? You need somebody that you can actually talk to, who could talk back to you in a way that you can understand, right? In a way that's not this medicalese and jargon that, you have to have 15 degrees to decipher,
right?
So that you can be in a space that's safe for you to ask the questions you need to ask, to say the things that you need to say, and get the care that you need to have. So that's my piece on the prostate and digital rectal examinations. Now, regarding colon cancer and colon cancer screening, it is very important beginning at age 45. Again, that number was dropped from 50, but beginning at age 45 to begin having colon cancer screening. Multiple ways to do colon cancer screening, okay? So there's something called a fecal occult blood test, which can actually be done in the office, and for an annual screening, 3 consecutive ones need to be done. And so there are little cards that your provider sends home with you, and you put a stool sample on there on 3 different days. You take it back to your doctor's office. They run a test on it to make sure there's no blood. All that does is it looks for blood. If there's blood, then your doctor is more than likely going to recommend you have a colonoscopy. Okay. Now, over the last 5 to 10 years, we've started with Cologuard. And Cologuard is a colon cancer screening kit that it's like a box. It's a paint can, basically, that they send to your home. You put multiple stool samples in the kit. You mail it back in, and the stool is processed to look for not only blood, but also to look for DNA. So it's a genetic test. So to also look for DNA for colon cancer, but also for polyps, which can be precancerous. Now, let's say you do a Cologuard test, it comes back negative, right? You're good for 3 years for your colon cancer screening. Okay. Now, let's say it comes back and it's abnormal. Then at that point, your provider is going to recommend you have a colonoscopy, because colonoscopy is the gold standard in looking for colon cancer. It is a direct visualization of the inside of your colon. Okay. So essentially, they put a camera into your bottom and look at your entire lining of your colon. And so if you have a colonoscopy, it comes back normal. You're good for 10 years, unless there's a family history. Like if there's a strong family history of colon cancer, then your provider might say you actually need to have your follow-up colon cancer screening in 5 years. You actually may need to have it in 3 years. So depending. And then the other thing, I want to back up to that Cologuard. Cologuard is really a screening tool for people who have low and average risk. It is not a screening tool for people who have a first-degree relative who's had colon cancer. That is not for you. Don't even think about that, because that puts you in a position where you're not getting accurate information whenever you already have a genetic predisposition to having colon cancer.
Got it.
Got it. I had my colonoscopy at 50, now 59. They said come back in 10 years and do it again. But during that colonoscopy, there were a couple of polyps. They, I guess, snipped them out.
Yeah.
They were not, and they were non-cancerous, which is why they said, yeah, we'll see you again in 10 years. Obviously I missed 55 because as I was leaving the office, one of the physician assistants said, black woman said, you come back here at 55. I mean, she just told me. They told you to come back at 60. You come back in here at 55. And I missed it, which isn't good because I believed her that I should go back at 55. But I wanted to just point that out. That they did find some polyps, a few, removed them, and I guess sent them off to be to determine whether or not they were cancerous, and they were not.
Right. Right. So more than likely they were what's called hyperplastic polyps, which are non-cancerous, right? Some of the other polyps, adenomatous polyps, serrated adenomatous polyps, those are the ones that you really want to pay attention to and come back much sooner. Yes. So the recommendation is every 10 years for your colonoscopy. I had my colonoscopy at 50. I will have another one at 55. Although my recommendation is to come back in 10 years.
Thank you for that.
Just me.
Thank you for sharing that.
You're welcome.
If it's good enough for you, Doc, it's good enough for the rest of us. So I will take your word on that. So
now, again, this is the thing. This is the thing. I have to put that out there. Not everyone is in a position where they're going to pay for that colonoscopy, because I'm going to pay for that colonoscopy out of my pocket, right? And so I would not for a moment be insensitive enough to be like, everybody just need to go and get a second one. It doesn't matter what they say. This is a choice that I am making for my personal health. And I think that we have to all make choices for our health.
Right. Yep. Right. Time to pivot, Darren.
Time to pivot.
Let's do it.
Oh, wait. Okay. So diabetes. Okay.
Diabetes.
Right. So diabetes is one of the preventable conditions that we find that impacts our African-American men. So there are people who are predisposed genetically, because my mama had diabetes, my grandma had diabetes, and my granddad had diabetes. Everybody had diabetes, right? So those people are going to have that genetic predisposition. Those people actually also, with education and with early intervention, like dietary changes, exercise, keeping weight low, have a better chance of not getting diabetes, or being able to manage diabetes with minimal medication and intervention, right? But typically in our African-American men, obesity is one of the leading contributors, apart from genetics, to getting diabetes, okay? And so again, obesity impacts getting diabetes. Diabetes decreases testosterone levels. Those lower testosterone levels contribute to central obesity. And when I say central obesity, is that gut, is having a rather round belly, right? Yep. So whenever you see that, or when I see it, I already know that person's testosterone is probably low, right? Because it just goes together. Yep. So diabetes, impact in central obesity, which impacts decreased testosterone, which my private parts aren't working the way they should. Right? And it's because all of those things go together. Like nothing is mutually exclusive.
Right.
And then put high blood pressure on top of that, right? You
Right.
have increased resistance to blood flow.
Yeah.
You need blood to flow in the parts for them to work.
Right.
Right. So all of these things work together to impact erectile health.
Got
Okay.
it.
So managing blood sugar, managing blood pressure, managing weight. All of those things are going to go a long way in improving men's sexual health.
Do testosterone levels decrease with age?
So yes, they can.
Okay.
They can. But we also all know some 60 and 70-year-olds still fathering children. So it's not necessarily,
You didn't have to put me out there like that.
decrease. Well, you are not 60 and 70, so you just put yourself out there.
No,
But
but I'm 58 and I have a 3-year-old.
but okay, and yes, that is awesome. But I was talking about the 60 and 70-year-olds. See, you just the guilty flee when no one pursues. That's what that is. All right. So anyway, so that is not across the board, but yes, with age, testosterone levels can decrease. But again, keeping optimal health is going to be our best bet in keeping those levels where they need to be.
Yeah.
Got it.
Good.
Got it.
Good.
So before we move on, and we're gonna pivot again outside of health, because I think you've answered all of our questions, and we could talk for hours about this. And I know you're on a schedule as well. A couple things that I want to do really quick is, I'm sorry, my wife is FaceTiming me. A couple things I really want to do. She must have heard me talking about her. One thing I want to do is talk about you shifting and opening up your own practice. So you made a pivot in your career. I went from working for someone to now working for your own, having your own practice. And then I want you to close us out with just some word of advice, health-wise, and then just as we approach this whole second half topic.
Very good. So yes, we talked a little bit about my residency training and that sort of thing. So after residency training, actually worked for 3 years in corporate medicine in Baltimore. Then the company I worked for decided they were not going to participate in outpatient medicine any longer. They were going to focus on hospital systems. So they shut my office down. We had 3 months to decide what we're going to do. Me and 2 of my partners in family medicine at the time decided to open our own practice, and this was in Baltimore. So was in the practice with them as a physician owner for 3 years. Then decided, you know what, I need to come home. I need to be closer to family.
Yeah.
So myself and my husband at the time, we decided to move back to North Carolina. So moved back to North Carolina, to good old Oxford, North Carolina, rural North Carolina, which was great. I really loved the relationships with the patients that I had there. People just grateful for healthcare and just real good old fashioned people. I really just loved it. So I worked for a corporation, but in rural North Carolina. I worked for Duke University, and I worked there for 10 years. Then decided to transition over to Wake Forest and worked for 9 years and 11 months for Novant Health. The last 4 years of which I was the lead provider in my practice. And whenever you are in that position as a lead provider, you see things both from the clinical, but also from a business aspect. Right. And you start to look at how things are run and why we need to be doing this. And, that started to, help me to see, you know what, I need to be able to make more decisions about how I see patients, the amount of time I want to spend with them, that sort of thing, because I'm a people person. I like my patient to come into the office and yes, we're going to talk about your blood pressure, your diabetes, your heart disease. And then I'm going to ask you about your grandkids. What's your daughter doing now? Is that job still going well? Oh my goodness, what happened? So that is just as important as a family medicine doctor, right? Understanding those things outside of medicine that impact my patients and that impact their health. And, you know, your son is strung out on drugs. So, of course, you're stressed out, right? So, that's impacting your health. So, I wanted to be able to be in a position where I could make more decisions about how I provided care to patients. And then in October of 2022, I was able to partner with Advanced Care and to open my own practice. And that has allowed me the opportunity to be able to do that. Initially, it was just me. And then I gradually added on. Now I have 3 other providers in my practice. We offer behavioral health in the practice. I offer nutrition therapy in the practice. And I also offer allergy testing and immunotherapy. So allergy care out of the practice. So we do a lot. We do a lot of activities in the community, especially in Wake Forest. You know, Wake Forest has lots of community events, and we participate in about one every other, if not every month, especially once the weather gets warmer. I think it's important to be able to do things in my community because I am trying to better my community one patient at a time.
Right.
Gotcha. So really quick, give us the sort of the speech as a doctor, only a doctor could, of how we can matriculate down this path of second half living and do it in a healthy manner and also live it to the fullest.
There you go. Well, I feel like this is kind of a summary of what we've been talking about all day, right?
Yeah.
So first and foremost, I think it just makes sense to make a decision that you want to live a healthy second half. Okay. And part of that decision is going to come with prioritizing self and health. Mm-hmm. One of the primary things, and I think this goes back to African American men really working hard to take care of their families. My hat is off to both of you and the men who are watching this, who it's important to them to take care of their families, right? That comes with a lot of stress because a lot of times African American men don't have the same support system or the same financial reserves that other men may have. And so that comes with a level of angst, stress, you know, anxiety in itself. And so first and foremost, I would say definitely to our men to prioritize yourself as well as your mental health. Get that support system of your peers, you know, your brothers, whether they be frat brothers or they be biological brothers, whatever, who you can just be your real and authentic self with. Super important to have that man group to be able to talk to. Yeah. Secondly, if you have a partner, a spouse who is supportive, just really being able to culminate a communication style and culminate an opportunity to communicate on a level that's vulnerable so that your partner, your spouse knows what you really need, knows what really impacts you, what stirs you to do the things that you do. Right. And then the third thing I would say is definitely making sure that you're getting those regular checkups, that you're going to the doctor on a regular basis, at least once a year. If you don't have any chronic health diseases, at least once a year. If you have anything chronic, high blood pressure, diabetes, thyroid, heart disease, anything, you need to be seen at least twice a year. Okay, very important. Just taking medicine is not enough. Someone needs to lay their hands and eyes on you to make sure that you're doing well and that you're responding the way that you need to whatever therapy that has been implemented. Okay. And so I would say those are kind of the big takeaways, but you know, especially for African American men, mental health is huge. Mental health is huge, and making sure that you are taking good care of your mental health.
Got it. Well, Dr. Ivery, it has been an absolute pleasure. One thing, I'm going to put you on the spot really quick because I don't want to get away from this. We got to have you back at some point. And I want to get a commitment right now in front of everybody that you're going to be back on our show.
Okay. So look, let me check my calendar. No, that would be absolutely fine. I absolutely love educating patients and educating people to be advocates for themselves. I tell my patients all the time, it's not my job to take care of you. My job is to give you the tools to take care of yourself, because you're with you all the time. I'm only with you once or twice a year. So you got to get good at taking care of yourself.
Wow.
You know what, ladies and gentlemen, that is that mic drop moment. It has been an absolute pleasure, Dr. Ivery. Thank you again for joining us. Guys, thank you for watching the Soul of a Man podcast. We are out.